My name's Lisa Keay. I'm an Associate Professor at the George Institute for Global Health, which is in the Faculty of Medicine at the University of New South Wales, Sydney. And I've been here for about 12 years or so. And I work in a lot of different areas. I'm a public health researcher, and I work with looking at problems of aging and vision loss, and also particularly uh, injury that can occur with aging, such as falls and also road traffic injuries. So, quite a broad area. Okay, so there is a bit of a story with this one because we were looking at the long established issue that people who have poor vision tend to be more likely to fall, and that's been established in lots of epidemiologic studies. And we actually had a NHMRC grant funded to look at this issue in particular. And one of my collaborators, Professor Peter McCluskey at SafeSight Institute, was really interested in looking at cataract as well. He's a surgeon. And one of the things that he was frustrated with is occasionally you really can't work out why people are satisfied or why people are actually unsatisfied. And this particular project was looking at the patient experience of cataract surgery, which many, many patients do experience. It's the most common elective surgery in Australia. And we designed a comprehensive study to look at the patient perspective and to try and work out just who is more likely to be satisfied so that we can better manage expectations and that services can be designed to meet patient needs. So this research paper is really the first step in this program of research looking at the patient perspective on cataract surgery. And it is important because we need to provide this service at scale. And we have a very large number of people who rely on our public hospital system to receive cataract surgery. And the majority of our participants in this study were on public hospital waiting lists. So it's very useful information to get an understanding of what level of visual disability people have. And that's not just their visual acuity, that's, of course, asking people about the impact of their cataract on their activities of daily living, how satisfied they are with their vision. And this study was quite comprehensive. We looked at things like depressive symptoms, we looked at whether people were driving, we looked at a patient-reported outcome measure, the CatQuest 9SF, and really showed that there's a range of different levels of vision loss, and certainly highlighted that there's a large number of people with substantive impact from cataract waiting to have surgeries. So optometrists are really critical to this pathway. They do provide the initial referral in many cases. You can also be referred by a general practitioner, but optometrists can provide a more comprehensive picture of the optical status of a patient waiting for cataract surgery. So they can look at their refraction and also look at their impact of their vision loss in a more comprehensive fashion. They can also provide input about the patient's expectations about their surgery. Many people are really looking forward to getting rid of their glasses. That's one of the things we have learned, that they're hoping that after cataract surgery they might not need their glasses anymore. And optometrists are really critical to managing expectations. So you might get rid of your distance glasses but then need glasses to read. So there's a few things to consider, and they're absolutely part of the pathway. Yeah, so I think what came out to us is that there's quite a range of levels of vision loss, and we know that cataracts can affect people in different ways. So visual acuity is just one measure, and there's more sensitive measures such as contrast sensitivity and obviously glare sensitivity. There's other things that can happen. We know that we did some investigations of looking at general quality of life, which is a complex metric to evaluate, and it's not particularly sensitive to changes in vision because obviously health related quality of life can have a lot of other influences. But what we did find is that, as other studies have found, that patient reported outcome measures show a range of impacts of cataract. There's a range of visual acuity. One of the quite startling statistics is that there's quite prevalent depressive symptoms in this cohort of people waiting for cataract surgery. And one of the other analyses that our group did showed that the level of depressive symptoms is actually related to the level of vision impairment. So that sort of hints to us that, there's quite a lot of negative consequences of having a cataract and not having it operated. And I talked about falls risk earlier, but certainly also general other problems such as depressive symptoms can emerge as well. So it's important to be able to map the characteristics of our patients waiting for cataract surgery. And we grouped the characteristics into preoperative factors, intraoperative factors, and postoperative factors. So then we can model them, and that's the next stage of the research to try and create models to predict who is likely to be satisfied and who is dissatisfied with their surgery. So this paper is really describing the method of the research study, but it also includes the baseline data. So it's a comprehensive snapshot of a fairly large group of people, over 300 older people with cataract. But the partner publication, which is being submitted, has completed analyses of modelling to predict satisfaction and visual outcomes. So, I mean, we all know cataract surgery is a highly successful surgery, but just the scale of the number of procedures we do mean that any dissatisfaction or any problems with the procedure do translate to pretty large numbers. So we really want to be best informed so that we can manage patient expectations and really provide the best quality care.